For joining us for this very exciting session here in the wonderful World Health Organization Pavilion. And we're really excited to have you all here today to talk about the importance of health and the renewable energy transition and a just transition for phasing out of fossil fuels. My name is Cassie Sutherland and I'm the Managing Director for Climate Solutions and Networks at C40 Cities. And I'll be your moderator for today's program. And I'd like to welcome and thank all of you who've come to the pavilion today, but also say hello to anybody who's watching online as we are live streaming our event. So it really is my pleasure to invite you and welcome you to this event of driving the end of the fossil fuel era, and for us to talk about how cities are leading a just transition to build a healthier world. It's so important that this discussion is taking place here at COP28, the first COP to have a health day, I understand, and so this is such a great achievement, and so it's really critical that we're here talking about this important influence and overlap between a just transition and health. So let me just give you a bit of context setting before we get into our very exciting panel discussions. So today we're going to be exploring these public health impacts of continued fossil fuel burning, highlighting it as a fundamental climate justice issue that is affecting city residents across the world, especially the most vulnerable. And in this critical decade for climate action, we know that the world is burning fossil fuels faster than ever before. We have a lot of discussion about phasing out fossil fuels, but the reality is global coal demand is at a record high, and fossil gas capacity is growing at a rate which threatens to push greenhouse gas emissions well beyond the limit needed to avoid climate breakdown. Across C40 cities, which is nearly 100 of the world's largest cities, fossil gas use needs to decrease by 30% in and around C40 cities by 2035 in order to stay on track for 1.5 degrees. But current gas infrastructure expansion plans will instead see an increase of 86% in gas use capacity in this time frame. So that's, in my maths, that's a pretty big gap that we still need to close. We know that if we continue to burn fossil fuels, we will not decrease or reduce this emissions gap, but importantly, we will continue to place a heavier health burden from air pollution on our city residents. And despite many gas exporting national governments increasingly promoting fossil gas as a clean alternative to coal, the analysis that we've done at C40 shows that fossil gas has never been and will never be clean. Some research that C40 released last year showed that air pollution from fossil gas was responsible for almost 36,000 premature deaths in the nearly 100 C40 cities around the world during the year of 2020. And that number is expected to increase, of course, as fossil gas expansion increases. And we all know that any source of air pollution and the impacts of air pollution are felt hardest by the most vulnerable, and children and vulnerable groups, and continuing to burn fossil fuels will amplify those impacts. So that's the reality of the start. But what are we doing? We're also going to get into some solutions today, some fantastic action that's being taken across many organizations and cities. So cities are really leading the charge to help get the world off fossil fuels, and they're undertaking proactive measures that either manage the demand and use and consumption of fossil fuels in the cities and also the supply of fossil fuels in the energy system. We see in the city of LA, they've closed down 38% of the city's gas capacity. In Cape Town, there's been reduced demand for fossil fuels through subsidizing of retrofits and upgrading of 40,000 homes. And expanding renewable energy in Mexico City is working to install nearly 800,000 meters squared of solar panels by 2024. And we're going to hear a number of other examples today, which I'm really excited about. So these actions really have the potential to save hundreds of thousands of lives, and transitioning away from fossil gas in C40 cities could avoid as many as 776,000 premature deaths by 2050. As well as avoiding $3.9 trillion in cumulative health and economic losses in this same time frame, and creating millions of good green jobs. So it seems like a pretty good idea. We should probably get on with that now with those kind of stats. So let's move on and now start to talk to our panelists. And just to say again, we're extremely grateful to the World Health Organization for hosting this event and providing this wonderful space for us. And now I really want to get into some fantastic sets of speakers who are going to explore this urgent need to phase out fossil fuels to meet 1.5 degrees and avert the climate breakdown. So, can I invite my first speakers to the stage, please? I'm very pleased to welcome the Mayor of Rotterdam, Mayor Abu Taleb, and Dr. Maria Neira, the Director of Public Health, Environment, Social Determinants of Health at the World Health Organization. Thank you both very much. Please make yourselves comfortable. Thank you. Dr. Neira, please, if I could come to you first. So, we're here. COP28, first COP with a health day, as we mentioned, in the Health Pavilion. And I think from the data I just provided as well, there's this growing evidence base and understanding of the impact on health of continued use of fossil fuels. So can you tell us about why it's so crucial to include health in the COP process?
Thank you very much, and thanks for referring to this place as a beautiful one. For those of you who don't understand what this sculpture is about it, because it's such an artistic thing that maybe you cannot see it, but those are our lungs, actually our bronchia. And this is something that we decided last year to put it at the Health Pavilion as a reminder to everyone that here we are discussing about emissions, we are discussing about Celsius degrees, but more than anything, we are discussing about our health. And this was the representation, putting the lungs at the center, very much connected as well to the issue of air pollution that you were describing. So we have been working for years now on what it resulted on having this health day. For the first time on a COP, on an official program of the COP, we have a health day. Means that the voice of the health community, which is very strong now. We have with us 50 ministers of health. We have a declaration signed by 132. The number is growing every day. Plus, we have 40 million health professionals signing as well. So it's a huge movement that now is irreversible. Some people was asking me now, oh, what's happened with euphoria? I say, no, there is nothing to be euphoric about. This should have been done ages ago. So nothing to be celebrating. This is just the Trojan horse that we are putting now in the COP, and from now on be prepared, negotiators, because health is there, and then in the name of health, we will do incredible things. Only health can give this sense of urgency that we need, and only health can accelerate this level of ambition that for the time being, I'm afraid is too low. My hope for those many years have been on you, mayors. No pressure, but you can save so many lives. I know that we are putting, even keeping calling you the ministers of health of the 21st century, because most of the actions that you can put in place can help so much to reduce the pressure and the diseases that are caused by air pollution. If you allow me just a very small anecdote. A few years ago, the mayor of Madrid, let me disclose the information, he was doing a tunnel to shorten the distance between the center of the city and the airport. And of course, the population was very much upset because the noise, because of the construction and all of that. And he was keeping telling the population, you will see the time of the commuting to the airport will be reduced. And I told him, and by the way, you will be able to reduce a lot of diseases caused by exposure to air pollution. And then he looked at me and his team, and he told his team, why you didn't tell me that there are health benefits? You should have telling me this, because this is the argument that maybe will convince my citizens, you know. And we can do that for you, mayors. We can quantify the health benefits of the interventions that you are putting in place. I know that sometimes poor Siddiq, poor Anne Hidalgo, and many others are going to tough times when they need to put some measures in place, but the health argument is always the winner. And if we can help you, you are our champions or if you take the right decisions or not, if you are not moving in a strong way on the right decision, but we can help you to quantify the health benefits. And I think this is the ultimate argument that can motivate people and then going around all of these protests and things like that. So I will stop here. Thank you.
Thank you so much, Dr. Nira. It's really important for us at C40 as well to be able to bring together those multiple benefits of climate action, of health action. And we also put a lot of pressure on the city mayors, but they can take it. But so maybe over to you. How do you feel about this pressure, Mayor Aboutaleb? But also, you know, we've really, through your leadership, seen Rotterdam establish itself as a leader, especially around climate adaptation and resilience, and leading to a marked increase in the city's resilience to the impacts of climate change, as well as in the clean energy transition. So would you like to tell us a bit more about how you manage that pressure and how you get the leadership on those actions?
How I manage the daily pressure is very easy. Having a good shower at the end of the day and sleep. That's the way to push the bottom and then to get it empty, even when I get criticism in the council. That's the easiest way to relax. Have a good shower on the top of your head. Women don't do that daily, but men can do that if you don't have not that much as I have. And then rethink the day. Rethink the day. Did I do the good things? And did I say the good things? And do I have to talk with someone because I was not objective enough? So 3 major criteria to evaluate the dates, and that which I do now for 15 years in my job as mayor, but I did also when I was secretary in the national government and when I was vice mayor in Amsterdam, now more than 20 years in government service. To tell you something about health conditions in Rotterdam, you have to understand a bit the geography of the city and its economic composition. We have the largest port in the Western Hemisphere. So we manage 30,000 vessel movements a year. Vessels that contain 24,000 containers. Huge. You see, in fact, apartment buildings moving on the water. We have more than 100,000 barges movements between Rotterdam and Germany. Germans here? Germans? No, nobody? Then I can make the joke. No, not criticize, make the joke. No Mercedes without the port of Rotterdam. All goods needed for making the cars in Germany are transshipped in Rotterdam. Iron ore, coal, energy, diesel, whatever. It's all transshipped in Rotterdam. So it's a main economic driver for years. And it manages some 500 million tons of goods. And the majority of the energy that we need for all these processes is passing through the port of Rotterdam. So we have a big carbon-oriented economy. That's the first thing. And to cut that, we do believe that you need mitigation in the short term, but in the long term, we believe that the only thing to do is adaptation. To calculate how long this mitigation will take, I'm an engineer myself, and I believe that everything in Mother Nature needs a transition. From incubation of a flower to the moment that the rose is going to open, it takes time. 20 years, 25, probably. That's not only because we need investments, and believe me, the money is there. If we shift money from buying weapons to this domain, we will have enough money to do that. That's my political statement for today. But we need also to convince people to go with us. And that is most complicated thing to do, convincing citizens that this is the right thing to do. We are talking here about macro approaches while citizens in our cities are thinking about the day, tomorrow, next week, and next month to connect the dots in terms of buying stuff to survive. So don't forget that we need to mobilize our citizens, and that's about just transition. Just transition means that there will be a solidarity into this system, that the strongest shoulders pay the highest price, and that will protect the others at the end of the other spectrum. And that is, at the end, a political choice. At the end, it is where to put your dollar. And I think that's important. We in Rotterdam have been fighting for years to convince Brussels and the Dutch government that we need for the transition a CCS system, a collecting of carbon emissions in the port. I have been striving for that for 15 years. That was my struggle. And finally, last year, the financial decision has been taken. So we're going to construct this system. This carbon emissions by the refineries, by the other petrochemical industry will be collected, made liquid, put in through public line pipe to the North Sea, to the former gas and oil fields, and to drop it there. It's ecologically responsible, and there are proven, it's already proven technology. It happens in Scandinavian countries and onshore in Germany somewhere not far from Berlin in the neighborhood of the Einstein laboratory. I was there, I saw it myself. That will collect millions and millions and millions of CO2 emissions and other hazardous particles in the air. So that is for the short term. But in the long term, we believe that construction of electrolyzers, which are now under construction, Shell is doing one, Gas Uni is doing one, and Eneco is doing one, that we move towards using eco-friendly sources of energy. And what my side agenda here is to talk to countries and companies to sign agreements with them to deliver to the Port of Rotterdam the coming years when they start producing hydrogen. The other one is to green the city. We have, I have here the number to use some 200,000 square meters of green roofs. That takes a lot of CO2 emissions and other hazardous stuff in the air, and it can capture more than 10 liters of water per square meter, which is also important in the city of Rotterdam that also has a big challenge with water. So at the end, we meet the criteria of the European Union when it comes to the air quality, but not yours. We are aiming to meet your criteria in 25. So we're not far from that goal, and I think that it's important that we gain support from our citizens. That's not, in my city, it's about 15%. You have to know that when it comes to the vulnerables in southern part of Rotterdam, we have statistics showing that these people are dying 5 years earlier than the average in the city, and that for years. There is not a scientific correlation between air quality and the cause of death, but for sure it plays a role. It's unhealthy behavior, it is smoking, it is food, which is not always healthy. The whole combination makes that we need them. That's why my academic hospital in Rotterdam, Erasmus University Hospital, is going to focus on the health issues in that part of the city to take enough data to see whether we can do something about not treating, but behavior and prevention. So I think it's really fantastic topic that you put this on agenda in the immediate vicinity of this COP28, and you have all support from my city.
Thank you so much, Mayor Boutelleb. It was so helpful there to get an insight into the challenges of a city such as Rotterdam, the port, the vulnerable populations, you know, the air quality challenges and the nature-based solutions. And
Einstein should say, this is an equation you can solve.
Yeah, yeah. And Dr. Nera, maybe just, I mean, using some of those examples, but also, can you tell us a bit more from your knowledge and experience about what some of the ways that continued fossil fuel use will damage health and impact health?
First of all, I think what was the presentation of the mayor of Rotterdam is a demonstration of what we knew already. When you have the political will, you can move mountains. And I think you move not mountains because you don't have it, but you move...
Moses with it.
But what you did is amazing. And please ask your scientists to measure, to quantify the health benefits of this measure that you are putting in place, because I'm sure they will be amazing. And I'm very happy as well to hear that this will allow you to go to WHO standards by 2025. You are really a champion, and we're extremely happy. And we need people like you. I mean, it proves that it can be done. Come on. Health is now a part of this agenda. There are plenty of studies. I mean, science is not an excuse. We have tons of science now. And one of the most evident is the 7 million premature deaths we have every year caused by exposure to air pollution. 5 million of them are very much linked to the combustion of fossil fuels. I mean, what else do you need? Somebody was asking me the other day, yeah, the evidence, where is the evidence that air pollution is affecting our health? I say, let me ask you the question the other way around. Do you have evidence that bad pollution is good for health? I mean, do it this way. Who likes to breathe toxic air? Do you? Who will argue that having a polluted city 10 times above the standards of WHO is good? I need to ask you several things, Mayor. We will have in October next year the second global conference on air pollution and health. So we need a strong presentation on solutions. We will focusing only on solutions. So we need your sample. We need your what you just described now, proving that it can be done, even if there are difficult things and it took years to do. We want to share all of those solutions, all of these ideas. We still have air pollution as one of the biggest challenges. Every day when you say 7 million and you are not on the headlines of the newspapers is something that I can't understand. What we are doing now is going even a little bit further on what you asked me about how fossil fuels are impacting us. We are looking at an estimation of the disease associated with the combustion of fossil fuels. Not only the number of deaths, which is horrible, we know already the cost for the health system, because people, when they talk about investment on climate change mitigation, they do not include the externalities, I mean the cost that we are already paying in our hospitals, which is already covering what it will be needed to mitigate climate change. So it's ridiculous how we ration in our society. But now the next step in WHO, we are looking at the prevalence of the diseases associated to exposure to air pollution, and that will be even another huge and horrible figure that we are putting on the table.
Yeah, and such an important way to end there around being a huge and horrible figure, but so important. And Mayor Abu Taleb, we have just a minute or two to go. But firstly, I think, will you accept the invitation from Dr. Nera to really showcase the work that Rotterdam is doing at the conference next year? And maybe just what other outcome would you like from COP28 that could really support you in taking more actions?
About the invitation, I have a very strong secretary. I'm never allowed to accept anything without consulting. I have 3 of them, and otherwise I get punished. So we have to look into that. But what I want to promise at least is I would like to make a video, a very instructive video, 3 minutes. I have been working for television years, so I know 3 minutes is a lot of time, to show exactly the practices of Rotterdam, to be honest, to tell where we think that we're doing the good things and where we have a distance to go. I think I will promise to make that for that conference. I have no idea what the travel agenda will be to me next year. There is a lot of things coming for the year in 2024. But I do believe that if the outcome of this conference should be not, again, a piece of paper arguing whether the scientists are right. I think sometimes things are subject to a good feeling. It's not always this. I take my decision over the day, 20, 30 decisions a day, half of them are this and half of them are this. It's not good what we are doing. Point. We're disturbing our ecosystems, our water, our food, our air. It's not good. But we need what we are doing now for a while, and I believe that transitions are possible. Like, you know, my credo, human beings started with stones, and everything was done by stones. Fire by stones, instruments by stones, and then suddenly we dropped stones and we went to something different. There was a transition, steam. And then we went from steam, the steam locomotive is now in the museum. We went to electricity and magnetism, and now we are in another revolution, the 4th one, Internet of Things, and the new one is to drop carbon. And we will drop carbon. We must drop carbon. That would take time, 20, 25 years, I don't know. We can shorten the transition time by acting and putting more money in it. That's what we have to do. And then engage citizens and cities. This COP28 should not be ideological debate between the ones that have really profited from the carbon and the other ones. No, this must be a COP of doers, and the doers are the cities, are the regions, and we have to convince citizens and to act just. I think this must be the outcome, not the debate about 1.5 degrees or 1 degree or 2 degrees. Fine. It's wrong what we are doing. That's, I think, what we all know, and we have to do something different. And history showed us that it is possible to move from one era to the other if we, as world civilization, accept that that is the horizon. So we don't need leaders with a vision, we need visionary people, and that's another word.
Fantastic way to end, Mayor Boutaleb. And I think you can see from the applause and certainly from us that we are, we're all in agreement there on the focus on action. I want to thank you both so much for spending this time and having this conversation today. I found it incredibly interesting and motivating. I feel motivated speaking to you both. So thank you very, very much indeed. And now, so some excellent insights really from our first segment there and first panel. And we're lucky that we're going to be able to continue some of this conversation. So in our second panel, we're now going to be addressing the critical issue of the health burden of air pollution on city residents. And I'm delighted to invite up onto the stage Shweta Narayan, the International Climate and Health Campaigner for Healthcare Without Harm, and Vinny Lopez, co-founder of the Climate Change Coalition from Rio de Janeiro. Welcome to both of you. So great, I think we're taking some energy from the first session that we're going to channel into this one, I think. So looking forward to the conversation. There's a microphone just between you there. So Shweta, if I could maybe come to you first and ask you to really talk about, from your perspective and experience, life experience that you were talking to me about earlier as well. Talk to us about the significance of considering health when thinking about the climate crisis.
Well, thank you. I think Dr. Marianera has already sort of set the stage, and it doesn't hurt repeating that climate crisis is a health crisis. And I have grown up in a very small city, which was an industrial city, surrounded by power plants, steel factories, and coal mines. So, as I say, I come from the belly of the beast, and I've experienced firsthand what air pollution does to us. And now, as we speak, most of South Asia is covered in smog and poor air quality, and air quality is so bad that if it were anywhere else in the world, it would trigger an evacuation. It's hazardous. And this is millions of population who are being exposed to toxic air pollution that is damaging their bodies on a daily basis. Until yesterday, we had a chest surgeon with us at COP who was showing these pictures of lungs with black spots, and these are permanent damage to lungs because of inhaling poor quality air. So I think when we talk about health, health is not just about absence of disease. Health is about what we breathe, what we eat, what we drink, and our surrounding. And that's why health is so fundamental when we're talking about climate. And when we're talking about climate solutions, we cannot think of solutions only as technical solutions. The solutions have to be health-based. It has to be human solutions where technology has a role to play, but it's not the end of all. And I think in all of this conversation, what is important and what is incredible to see in this COP, the role of the health community and the health professionals. And again, I'll go back to that story. So for many years that I lived in this city and I grew up, and it's where I belong, and I had been suffering from a lot of health problems that I didn't realize, and it was sort of like assumed as these are common problems that everybody suffers. And when I went to college in Delhi, and I was so sick, I had to go see my university doctor. And I just described my symptoms. And the first thing that doctor said, "Are you from this city?" So health professionals have the knowledge, experience, and data. And the question is that how do we leverage that evidence That is with the health professionals in influencing policies and in supporting communities and creating a groundswell for a demand for action.
Such fantastic points, Shweta. I mean, I really love the example of you giving there at the time of your experience, but also this point of the air quality being so bad that it would trigger an evacuation. I mean, really, I think thinking about those connections, and for me, as we're looking around the world and seeing more and more evacuations of areas due to climate impacts as well. This is, I don't know, it's just really kind of, that will stay in my mind. So thank you very much. Vinny, as a young person from Brazil, which is facing an increasing number of heat waves. I know, you can tell us really that lived experience of heat waves as well. Can you share a bit of your experience, maybe just from this year, where I think I understand Brazil registered 8 heat waves before the summer period even began. So can you give us a bit of an insight into the health impacts of those?
Yeah. So yeah, I was thinking when I was here on the way through here, that I think that if this question was made for me like last year or 2 years ago, it would be harder to explain or harder to address these impacts on our day-to-day life. But now, and specifically this year, we've had like so many impacts of heat waves, of smoke, as you were saying. There's also this big smoke right now in Brazil from the Amazon, and it's going all over in Brazil as well. And the heat waves, on the past 2 weeks, there was this extreme heat wave all over in Brazil, and we've reached like 45 degrees and with a sense of 60 degrees almost. It was almost as if we were in an open oven. It was so extreme. And when we face these challenges, we see that the climate change is now, it's happening now, and we are suffering from it. And people, and specifically also people from more vulnerable places in Rio, from more vulnerable places in Brazil itself, are suffering even more. So from the smokes themselves, I have a lot of friends, some of them are here at COP also, advocating for rights and so on. And I would go every day on Instagram or on my socials, and I would see them saying that they were like waking up with a nosebleed and so on because of the dryness of the air. And children also, they had to be with, I don't know the name in English, but those things that they have to refresh the air and so on. And all of this, so the impacts are very like on our faces right now. And this year specifically, almost every day we have it on the news and so on, how these impacts are happening every day in our constant life. And also I was telling everyone, and this recent example as well, from the heat wave in Rio. There was also a concert going on this weekend from the extreme heat wave, and a girl has died there because of the extreme heat wave. And due to as soon as I left Brazil, people were still investigating the causes, because it's even hard to point out how did this person die. She was like 22 years old. It was a young girl who died because she was inside a place that was so warm, so hot. And when we face these things, these disasters, these extreme bad things, we see that we have to take action. We need policies. We need more than individual actions. We need the collective action and policies and so on, because these are the effects we have from every range of health effects that are being extremely dangerous for our health, and are being extremely raised due to the climate crisis that we're in. So I think the message that I want to leave is that it's now, it's happening. It's not more about the gas on our refrigerator or on the deodorant. It's now everything, every day, on the daily basis. So it's intense.
It's intense, Vinny, and I mean, but you've put that so well and really just articulated, those day-to-day challenges, and and like you're saying, we're seeing these impacts on our faces, aren't we? On the faces of children, of our peers, of people all around the world. So thank you very much for sharing that. Shweta, I know that you have worked closely with community health workers on the challenge of tackling air pollution and poor air quality and its devastating impacts, particularly in central India. Maybe you could share some of the unique perspective that they have been able to bring to the conversation.
Yes, and thank you for that. And in fact, I was just listening to Winnie, I was thinking, yeah, the action has to be, the solutions have to be now. And this is probably one of my favorite examples of solutions led by health professionals. So primarily, we've been working in central Indian state, which are like fossil fuel reserves and highly industrialized states. And then we've been working with community health workers. And community health workers are especially important because they are the first link between the communities and the public health systems. So they are the ones who are sort of out there seeing, witnessing, living those health impacts of air pollution, climate crisis, and what they report back, and this is important, this is where the policy and action comes in, their voices are important in shaping the kind of policies and health policies that we need at a subnational level. So this particular community geography, the women health workers have whose jobs are primarily to look at maternal and child care, realized that despite, no matter what they were doing, and they were doing everything by the book, all the medicines, all the vaccines, the birth outcomes were really, really problematic. And because this is intensely polluted air, region. And so they sort of like, their experience told them that there was something else that was important to consider, and it's not just those medications and care that they were providing. And they realized it was poor air quality. And these are places, these are geographies, very small towns and cities that don't have infrastructure for even air quality monitoring. So how do you incorporate solutions that benefit people? Because for community health workers, it was their constituency that was hurting the most, and also integrate actions in policy. And so we worked with the community health workers in training them on science of monitoring air pollution, using low-cost monitors, using our bodies as monitors, and the information that was coming out was, like, again, flowing two ways, and this is where I feel, again, that health professionals have a very important role to play. They lend validity to communities' concerns by giving them ways to protect themselves. And they use that information to influence policies. And this is exactly what the community health workers did. While they were issuing air quality alerts and poor air quality alerts, especially to pregnant women and mothers who had just had babies, they were also feeding back to the health system that our concern in our neighborhood, we need subsidized medicine for lung health. And so that led the health system in that state itself tweak measures to ensure that wherever there are polluted hotspots and wherever these kind of reports were coming back, specific systems were created or are being created to address problems of air quality inequities. So my only takeaway, as for people involved in city level planning, I think cities, we have heard this, cities are very, very important in action, in climate action and resilience. It's important, again, when we are thinking of cities, we need to put health and health-based planning in cities. So even when you're looking at infrastructure, when you're looking at new roads or highways, I think the times that we are in, we need to decide those public infrastructure based on health. So we need a health impact assessment more than an environment. I mean, along with environment, I wouldn't say environment impact assessment is this thing, but we need additional health impact assessment because we have to build cities that can withstand the climate crisis, withstand the problems that we are seeing. And for that, health would be foundational, health will be critical in deciding whether the cities survive or cities perish.
I really like the practical example there, Shweta, of saying, what about a health-based urban planning system? But so I think, it's definitely something at C40 we'll go and explore with some cities. But just also, you really emphasized to me, the importance of looking spatially when it comes to air pollution, no matter the source. Of course, if it's coming from burning of fossil fuels locally nearby, it's coming from transport, it may be coming from waste systems. But, really that need, therefore, for bespoke and targeted action, using the knowledge that you have in place, the community workers, the community health workers, and really therefore designing those solutions that are going to fit for purpose. That's something I think is very, very powerful. Vinny, maybe I can come to you to take us now about, where next and how do we also get to some solutions here. So what do you think some of the ways that decision makers should factor in the health impacts of increasingly extreme weather events? Do you have some suggestions or ideas on that?
Yeah. In Brazil, there's been this not recent, but the NGOs and the civil society in general has been gathering together to get new data about stuff, to get new data about air pollution themselves, to get new data about air quality, to get new data about how to build resilience on the city when we are talking about the urban drainage and so on, because in Brazil, we have this issue with data, like public data. How do we address problems that are very specific in some suburb, in some area, in some slums, in some favelas, that are not common to the other parts of the city? So in the recent years, as you of course know, it's been so hard for us to be talking to our government, to be talking and addressing our issues to the government. And now, in the last year, we've changed the government. So now we're trying to catch this opportunity to go there and to offer them the solutions that the peripheries, the communities themselves have already been coming up with. And not only as like we always saying this, that it's not only because we want to, but because we need to. So I think that most of the solutions and most of the of this will to address climate change and to address solutions should be also combined with the knowledge of the people who are facing these issues since ever. So I think this connection has to be made, and we know that this is a big challenge because not everyone can be here at a COP, for example, and be talking to a minister and be talking to the mayor or be talking to the secretary that in the end of the day are going to be the people who are responsible for the policies and so on. So I think that our ways that we've been trying to address and trying to advocate for these climate rights are trying to find these our ways, our paths into talking and bumping into people and having our policy briefs by the hand so we can address them, what we've been thinking about, what solutions have we been coming up with, and so on. So and that for everything, for the floods, for the air quality, for the smoke all over the cities, and so on. So I think that at the end of the day, all the solutions, all the resilience plans, all the policies should come from this conversation and from this dialogue with the communities and with the people who are going to be the most impacted after all, right?
Thank you so much, Vinny. And again, another kind of really targeted intervention of, true consultation and co-design with communities that are most affected. What another great panel. This was fantastic, so informative, wonderful to hear your experiences and really great solutions that you've both suggested. So a huge thank you, Shweta and Vinny. It's a pleasure. Thank you. Thank you. So I'm now delighted to invite our next set of speakers onto the stage. So please could I invite the Mayor of New Orleans, Mayor Cantrell, please come and join us. And Juliet Oluwatch, who is a C40 youth member and ARIN research assistant. And we're going to have a discussion here between the three of us all around city leadership on the just transition and its need to raise the ambition globally and how we can have that local to the global. So thank you both very much for joining me. We're really pleased to have you here. So Mayor Cantrell, maybe if I could come to you first, if that's okay. And And could you tell us a bit about the actions that you're doing in New Orleans to provide cleaner energy for residents to tackle some of these issues we've talked about today?
Sure. So good afternoon, and thank you to the C40 family for inviting me here. And always good to talk about the city of New Orleans and, of course, us taking action relative to climate that has already changed. So it's more like climate adaptation. But we have embraced our climate action plan, of course, wanting to cut our emissions by 50% by 2035, but of course eliminating them to that net zero by 2050. So having a plan is very important, and of course you move then towards implementing that plan. As we look at it, a key component is of course wanting to provide clean energy. And looking at ways in terms of our people, if you will. New Orleans is 26% of our people live at or below the poverty line. 2/3 of our residents live in census tracts that have been deemed disadvantaged by the federal government. So we have to be very intentional about our approach so that we do bring people along and looking at it from that health lens, always being intentional. So when we think about that plan in which it calls for even solar, 255 megawatts of solar and also wind energy within the next decade. In addition to wanting to have a community-based solar program in place, one of the first in the state of Louisiana by 2025. So again, the goals set in the plan drives the work. So a center part of that is looking at where our emissions are the largest in the city. So it goes into homes, right? Homes and businesses. So looking at that and meeting people where they are and talking about the health of our folks, creating a quality where people live has to be that priority. And so the Solar for All program is one that we have established, again, meeting folks where they are, trying to get the bear out of their pocket, so to speak, in terms of what they have to spend, but it's the air quality as well. So the Solar for All program is one that is moving forward, but also weatherizing homes, because we have to ensure that people have healthy homes to live in, especially when we are faced with an affordability crisis. So again, you have to look at this holistically. Air pollution that's in those homes, not just talking about the expenses to maintain a quality of life that all of our people do deserve, but keeping them in their homes and in neighborhoods and making sure that they're not pushed out of the neighborhood. So we're being very, again, intentional relative to that. And so I will stop there. I know more meat on the bone will come as we move through the panel.
Fantastic. Thank you, Mayor Cantrell. And what I love about your answer there is you really, emphasized the whole point of this panel, which was about why are we looking at city leadership to be able to raise ambition globally? Well, exactly because of the things you mentioned, meeting people where they are, understanding the community, being able to therefore design programs that improve the health, but also switch to clean energy for the community, like your Solar for All. I think it really kind of shows that action that is being taken in leadership at a city level. So thank you for sharing that. That was fantastic. Juliette, thank you for joining us. Maybe I can come to you now to think a little bit about your perspective about, that urgency of needing to move from fossil fuel use to clean energy, and give us really your insights into that area.
Thank you so much, and it's a privilege to be here on this panel today. So I'll put it in 3 ways. Number one is it is better for our health, it is better for the economy, and it is better for the climate. So here are the reasons why. I'm going to explain a little bit. Renewable energy is cheaper than fossil fuel. And C40 research has proved that by stating that for every $1 million US that is invested in residential retrofits and solar development could actually create 6 times more jobs as compared to renewable energy. If that is not convincing enough, another research by C40 Cities shows that over 14 million good green jobs have already been created in 53 C40 cities. So that is a testament that we need to actually move from fossil fuels to renewable energy because it is good for the economy. I also mentioned that it is good for our health. Did you know that over 700,000 deaths, premature deaths, occur every year? I mean, we could save over 700,000 deaths by 2015 cities simply by moving from fossil fuels to renewable energy. So those are the main reasons, I think, and I'll look forward to explaining more.
Thank you, Juliet. And so clearly laid out there as well, which is just fantastic of, kind of the why wouldn't we do this again, really across all those three areas. So now I'd like to turn to a couple of questions for both of you about the importance of a just transition to a renewable energy future. And, we know that there must be a just and fair transition alongside this. And so, Mayor Cantrell, when thinking about clean energy and what you're doing in New Orleans, what kind of actions are you taking in the city to support workforce development in all sectors?
So when I answered the first question, I talked about the disparity gaps relative, to my people living at or below the poverty line, those who are living in disadvantaged areas. So when I think about a just transition, it really is about the workforce as well, and wanting to ensure that it's equitable, it is inclusive. And especially in our city that has been driven, the economy has been driven primarily by hospitality. So this is another opportunity to diversify our economy with good jobs, right? And so when the city is spending hundreds of millions of dollars on green infrastructure, we have to make sure that we have a workforce to maintain that. But it's also an opportunity for our people to have, one, quality jobs that they can now participate in, moving away from hospitality. Not that we don't want to play to our strengths, but you want to make sure that you're creating a livable wage for your people, an opportunity to build wealth, transferable wealth. So again, force multipliers and looking at this holistically. So the Mayor's Office of Workforce Development has been very much focused on industries, healthcare, green infrastructure, building trades, transportation, logistics, advanced manufacturing. This is our opportunity. But also making sure that we're connecting our residents to these opportunities through workforce development training. And so we have been very intentional about not only identifying that job seeker, but also the employers and connecting them to them. So we have these, we call them industry boards, if you will, in these various areas that I mentioned. And so the industry boards are intentional because it creates that table set with that resident, that job seeker, and with that employer, where the employer can get a better understanding of what even that employee may need. So not just providing the job, which is important in these growth areas or industries, but also digging a little bit deeper. Maybe the family needs better access to health care, family medical leave, quality affordable housing. Again, having to think holistically about building your people up while you're also adapting to climate change. So we're looking at force multipliers in the city of New Orleans. We believe we have to do that because your people are your strength, and you have to bring people along. And in order to get them to care about adapting to climate that has already changed, you have to meet them where they are because they're struggling day by day. And so when you can bridge the gap and show them that you care holistically about them, then you'll bring them along, and not only that, show that we matter in terms of cutting our carbon footprint. That's not just New Orleans or Louisiana or the United States. It's the planet. It's the world. So COP28 is why we're here.
Great. And I really like the phrase force multipliers when it comes to workforce development and job creation, because it really just gives you that way of saying, yeah, how do we make something that is greater than the sum of its parts here? We're not just monitoring, have we got X new jobs and have we got X this, it's really looking, what is the impact on the lives of people within this city?
Well, and people have to, you want your people to believe that these jobs that are being created are for them. And C40 has done the research. You've indicated that these 30% in terms of the growth in these industries. But for a city like mine, our people have to know that they're part of the solution as well. And we're not creating these jobs for other people to come in to get the job. That we're creating it for them.
So important, so important. And Juliet, you've been a real powerful advocate for investment and support for a just transition, I'm sure across many of the things that Mayor Cantrell is talking about. So what do you see as a real priority to ensure that young people are brought along in the just transition away from fossil fuels?
First of all, national governments need to move from subsidizing fossil fuels to actually financing just transitions. So this is very critical, especially to the younger generation. I would like to say that the problem is not actually the money, but the problem is where do we channel the money. So if we channel the money in fossil fuels, we're only thinking about profits, but we are forgetting our health, we are forgetting our economy. But when we switch to a just transition, we are actually not just creating jobs, but we are taking care of our populations holistically. We are talking about more jobs for young people. We are talking about better health, because we cannot work when we're not feeling well in the first place. So I'd like to say that cities are already leading the way, and finance therefore need to be channeled to the cities, and it needs to be direct finance, and it needs to be easy to access and adequate for cities to actually continue leading the way in the just transition.
Fantastic point. And maybe I can ask just a follow-up to you, Juliet, there on, have you got an example of some of that you think is really working? Because let's try and get everybody here to copy it.
Absolutely. So I would like to start by also taking you back a little bit. I come from Nairobi, the capital city of Kenya, and in Nairobi, 60% of the population stay in informal settlements. So what this means is basically they have no access to the basic services that everyone needs, really, when you talk about jobs, when you talk about healthcare, that is insurance, and so on and so forth. So accelerated just transition process, really what means for them is there has to be support, but also there needs to be greater ambition when we talk about the question of just transition. Africa as a continent has the youngest population, over 400 million people aging 15 to 35. So all of these people, most of them are unemployed and they lack opportunity. So what needs to happen is choosing the pathway of a just transition will ensure that we promote economic growth in these cities, but also we are reducing our emissions significantly. And this leads to inclusive, resilient futures for us all. So a well-funded, well-supported just transition means a lot for the African youth. And just to give an example, Nairobi recently hosted one of the first ever local stocktaks contributing directly to the Paris Agreement. And some of the key issues that were arising is the role that cities play when it comes to NDC implementation, when it comes to reducing emissions, and the communities actually understand what role they play and how they need to do it. So what we need to focus on is intergenerational collaboration with cities, official, with governments, and with everyone, leaving no one behind, because that is also the essence of a just transition. A transition is not just when we don't talk about youth. It is not just when we don't include the marginalized communities. So my call to action would be, let us work together, let us bring everyone on board, but let us remember that cities have to lead the way towards a just transition.
Thank you, Juliet. And from talking to the other day, I know you have had a big role in the local stocktake as well. So thank you for all of your work and efforts there. So Mayor Cantrell, maybe leading on that point, you're showing city leadership already. I think that Juliet is saying cities need to lead the way. And as you mentioned before, you've got a strong plan in place that's really allowing you to set those ambitious steps. But, we also know cities can't do it totally alone, can they? They also need a whole infrastructure of support, state level, national, and beyond. So what support do you need, or do cities need, to really achieve these goals? What do you think are the main asks?
Sure. So it is funding, right? So it is investment, both on the public side and on the private side. But it's also demonstrating that you can do well with resources that you are receiving now and able to leverage those resources. And so right now, for example, the city of New Orleans has an influx of federal money. Federal money that is being invested in our infrastructure. I talked about green infrastructure, how we're spending hundreds of millions, and we are. That is primarily by grants that we've received from the federal government, like 141 million to create resilience districts throughout the city, where you're creating systems to store stormwater, for example, to free it up from going into our drains and, of course, into homes and in businesses. But it's also the opportunity, one, to leverage the federal dollar to get additional money. So I've created a infrastructure task force specifically around federal money that the Biden administration has made available to cities in the United States. And so being very instrumental in that, we've been able to leverage recently $8 million from the USDA, Department of Forestry, for our urban canopy, planting trees. Our goal is to plant over 40,000 within the next decade. Here recently, 1.3 million that we've received for our Bayou Bienvenue wetlands to create that barrier, because we are on the front lines of climate that has already changed, so adapting. Even 55 million recently from the Department of Energy to replace our grid. So all of these initiatives are being leveraged not only with federal dollar, but also public dollar as well. So again, when you're demonstrating that you're doing the work, it puts you in a position to get more resources, but also to work collaboratively on not only that public side, but that private side as well.
Fantastic. And what I liked there was, my question was, what more do you need? And you gave me a solution, which I like even more. So that was brilliant about, this is really the model that can scale and can deliver action. So I think that brings us to the end of our time. I just want to say a huge thank you to both of you. Another fantastic panel, and really bringing a huge amount of solutions and momentum and energy to this very challenging issue. So big thank you.
Thank you very much.
So we're nearly coming to the end of our time today, but we do have a very exciting keynote speaker to close off the session for this afternoon. And so it's my absolute pleasure to introduce our closing keynote speaker, Vanessa Nakate, who many of you will know already, but is a Ugandan climate justice activist. Vanessa.
Thank you so much. I am not a cities expert. I'm not a medical expert as well. But you have already heard from incredible people who have great knowledge about how cities can lead the way to a just transition and a healthier world. I have learned so much myself that I will be sharing with my father, who is one of the mayors in Kampala. I know that he has a huge responsibility to address the impacts of the climate crisis on our health. I am a climate justice activist from Kampala in Uganda, and while I may not be a city or health expert, I can tell you that where I live, our people are forced to breathe dirty air. This new research shows that fossil gas air pollution caused over 35,000 premature deaths in 2020 across C40 cities. If we zoom out further, the WHO warns us that millions of people around the world are dying prematurely every year from breathing air that is made toxic by the burning of fossil fuels. But you don't have to be a doctor or a scientist to know there is a problem. When I am in Kampala, I can see it and I can test it. We know this is not just a problem in Kampala. Almost the entire global population, 99% of us, breathes air that exceeds WHO air quality limits and threatens our health. Air pollution is particularly dangerous for children. We know that air pollution stunts the development of children's lungs, their hearts, and their brains. Doctors are even finding soot, the black dust created from the burning of fossil fuels, in the placenta of pregnant mothers. These toxic black particles can cross the blood barrier and even make their way to the unborn child. So almost all of us are breathing unsafe air, especially in the cities. And this toxic air is harming so many people and killing so many people as well, by the millions and every year. But if it wasn't bad enough, we know exactly how to prevent it. We need to shift to clean, renewable energy as swiftly as possible. And we need to stop burning fossil fuels. For far too long, the fossil fuel industry has manipulated and deceived the public. They have denied and delayed crucial scientific information and put profit before people. Fossil gas is not clean, and there is no such thing as clean coal. All of these are lies, and carefully constructed lies, to hide the truth about the devastating health impacts of burning fossil fuels. The truth is, fossil fuels are killing people. The actions of the coal, oil, and gas industries have created the very conditions of the climate crisis that we witness today. And the communities most affected by this crisis are usually the least responsible for fossil fuel use. More and more leaders here at COP28, civil society, countries, businesses, and cities are calling for a fossil fuel phase-out. Not only must we phase out fossil fuels to protect our climate, but also protect people from the unjust impacts on their health and standard of living. We must end investment in polluting fossil fuels and scale up investments to deliver a just transition. But one cannot deliver a just transition in isolation. All levels of government, business, unions, and communities must work together to deliver a just energy transition that leaves no one behind. I call on leaders at COP28 to meet their duty of care for the world. It's time for the billions we need to accelerate climate action and climate justice to be unlocked. It's time to cut off the polluting industries from public funding and curb their outrageous influence in political spaces such as the COP. There are over 2,400 oil, gas, and coal lobbyists here at COP28, and we've had enough of that. People in cities should be able to breathe safe air. People everywhere should be able to breathe safe air. We need a just and equitable phase out of fossil fuels. We need clean air for all. The best time for action was yesterday. Let's not waste another time. Thank you.
Thank you so much from Vanessa for that inspiring closing remarks. I mean, I had a few notes here to say, but there's no point in saying any of them. Vanessa said it all. So what an amazing morning. I've worked in climate change for a long time, but I feel truly inspired and more educated after this hour and a half hearing from all of you than I did beforehand. So a huge thank you for that. I really, really appreciate your time. So I know that this will, it's fueled me. It will fuel the action at C40 even further. And so I know that we will hopefully move on this transition together. So that concludes all our event. A huge thank you to all of the speakers. A huge thank you to those of you who are here. And a huge thank you to those of you who are watching on the live stream. Let's carry this momentum from the event and continue advocating for the just transition away from fossil fuels, a halting of the burning of fossil fuels, and a healthy future for everyone. Enjoy the rest of your day.